So my name is Trevor Goodyear. I use he, him pronouns, and I'm a nurse and a PhD candidate at the UBC School of Nursing, where I'm starting as faculty come July 1st. So the Queer Eyes, Queer Lives photo exhibition is part of Vancouver's Queer Arts Festival. And really, it's reporting on 2 photo voice studies with 2S LGBTQ+ youth who use drugs and showcasing the different ways that drugs are featuring in these young people's lives. So including with respect to housing and mental health, with identity. So really getting at a fuller picture of 2S LGBTQ+ youth's substance use. So the Queer Eyes, Queer Lives photo exhibit has been a long time coming, and there's been a lot of work behind the creation of this exhibit. And one of the key groups leading this work has been the Substance Use Beyond the Binary Youth Action Committee, or who we lovingly call the YAC. And this is a group that was started by myself and my colleague Christian Barberini as part of their master's thesis a couple years ago. And this action committee, or YAC, evolved over the last couple of years to really center Christian's thesis as well as my PhD study looking at the substance use and homelessness experiences of 2S LGBTQ+ youth. So the Queer Eyes, Queer Lives photo exhibit draws from 2 research studies that used photo voice or participatory photography as the methodology. And with photo voice, our aims were really to democratize our research, so make our research more accessible and more participatory and really community-led. At the same time, we chose to use photo voice because it's a really helpful approach for highlighting sensitive topics or stigmatized topics. So young people in this research had the opportunity to go out on their own time and really capture nature or buildings, art, metaphorical images, or whatever really came to them that reflected their experiences with really complicated topics. We're showcasing photographs from over 60 young people in Vancouver and across British Columbia, all 2S LGBTQ+ youth between the ages of about 14 and 29, and really depicting how substance use features in these young people's lives, but also how substance use can connect to other aspects of their lives. So while youth sometimes spoke about substance use as a source of challenging times or hardship or risk or harm, they also spoke about how substance use can be a bridge to different kinds of opportunities. So to think through and figure out their identity, and also to help with their housing and material circumstances. So for example, using drugs to stay awake when they couldn't get a place to stay for a night, and just to be able to keep oneself safe and secure in the absence of broader material and social supports. So the Queer Eyes, Queer Lives photo exhibit really captures insights about men's mental health inequities in a number of different ways. And the images really capture some of the mental health hardships that these youth were going through, but also the ways in which they are working to overcome these inequities and build more equitable and healthier relationships with substance use and mental health and with the community. And one example is a young trans man in this study who used the pseudonym or fake name Star. He took a photograph of himself walking on a sidewalk that's has some rainbow lighting on it. And he titled this photograph Lost in Color. It really captures both some of the issues he was facing as a young trans man, including, family conflict, queerphobia, transphobia, but also his resilience despite these issues and his will to really forge a sense of community and belonging and a better future for himself. So it speaks to some of those challenges, but also captures a way forward for many 2S LGBTQ+ youth, including those grappling with mental health challenges. I would say that support from the Reducing Male Suicide Cluster has been really integral to this work. I've been a trainee with the cluster for almost 3 years now, and the group has really foundationally shaped how I think about gender, as well as gender-based inequities and gender relations. So while much of our work with the cluster is focused on men and masculinities, I've really gained a deeper appreciation for how gender in a broad sense is a critical piece of identity and social context to consider when we're thinking about 2S LGBTQ youth's lives, their substance use, and the issues that they face in their community. There were many memorable moments with planning and executing the Queer Eyes, Queer Lives photo exhibit, and it's hard to just pick a few. But one that really stands out, or 2 that really stand out, I guess, is first actually sitting down and framing the photos for the exhibit. We got together with the Substance Use Beyond the Binary Youth Action Committee and actually all sat down together over a couple of days and at lunch and then framed the photos together for the exhibit. And it was a really wholesome moment and also rewarding moment to take all of our work together over the past couple of years and see it physically in front of us and framed quite beautifully and showcasing the beautiful art that you've produced as part of this research. And a second related moment that I found a lot of joy in through this process was going to the Sum Gallery in Chinatown, downtown East Side area, and mounting the photographs for Queer Eyes, Queer Lives on the walls of the exhibit, and really just seeing it all come to life and seeing our hard work come to fruition. And it's really a joy to have our exhibit as part of this huge festival and to be working with community to deliver this exhibit, because it really is a celebration for us. It's a celebration and an opportunity to really shine a light on some of the issues that young 2S LGBTQ+ youth in our communities face, but also the real strengths, resiliencies, and politicalities of these youth as they're navigating and overcoming and working to redress these issues and advocate for more equitable and just communities. So it's been a pleasure to work with the gallery and with the broader 2S LGBTQ+ community, especially the youth, to make this work happen.